I'm Dr. Thomas Magliaro. I'm a member of the St. Peter's Physician Associates, and my specialty is gynecology and gynecologic surgery. I was born and raised in New Jersey. I've been here all my life. I'm a New Jersey boy. I've been associated with St. Peter's since the mid-'80s when I was a medical student at Rutgers Medical School, and I went on to do my residency in OB/GYN at St. Peter's in the Brunswick area. So I've been here for over 30 years now. I've been an attending physician since 1991. I really think it was my next door neighbor when I was a little boy who was my family physician. I think he was my first sort of inspiration in the field of medicine, and he really seemed to enjoy what he did, and he was just a real caring and type of a person, and I watched him as I was growing up, and I think that's where my first interest in medicine came along. Then as I went through undergraduate college and some postgraduate work in the sciences and the combination of both science and working with people, medicine seemed to be the ideal choice. I've always enjoyed St. Peter's. When I did my residency, we worked at 3 different hospitals, and each one had their own personality, if you will. And St. Peter's always seemed to be, to me, the best of being in the forefront of my area of interest, as well as being one that the patients really seemed to like. They always had a good experience when they came to St. Peter's. The staff members were always easy to get along with, well-trained, took good care of the patients. And the patients, I really think, come back and tell me their experiences at St. Peter's have always overwhelmingly been a positive experience. And so I think it was just all the combination of things that led me to want to practice at St. Peter's during my career. I think in medicine, we have to have a philosophy of staying up with the latest technology or information or field, but also holding back to some of the old days of spending time with the patient, listening to the patient, and treating each patient as an individual. And I think I've always tried to employ that in my practice and trying to find what's the best treatment plan for my patient, not just plugging somebody into an algorithm and saying, oh, you have this, you're going to get that. And so I think the patients appreciate the individualized attention that we give them here in our office. Oh, I think the rewards are always your patients' gratitude and happiness with the way you're treating them. I think that's my biggest reward. And thank you for choosing St. Peter's.